This presentation is about Parkinson's disease and a specific treatment of it. Parkinson's disease, or PD, is a degenerative disorder of the central nervous system. It is caused by the death of the nerve cells in the brain that produce dopamine. Dopamine is a hormone in our brain and a neurotransmitter. It stimulates the pleasure centers, so it's commonly known to make us happy. Produce this when we eat chocolate, when we smile, and after we exercise. Lack of dopamine causes physical symptoms such as slow movement, muscle rigidity, and tremors, and mental-related symptoms such as behavioral problems, dementia, and most commonly depression. There is no cure for PD. Luckily, there are treatment options, and the disease is non-fatal. However, patients that have PD have a lower life expectancy than those that don't have the disease. This is dopamine. Now, common sense would suggest that giving patients who have PD doses of dopamine would be a treatment of this disease. However, dopamine, as it cannot pass a blood-brain barrier, so doctors use levodopa. Levodopa can pass through the blood-brain barrier, and the body naturally converts levodopa to dopamine. However, it's not that easy. See, levodopa passes through the blood-brain barrier through passive diffusion, as can be shown by this simple movie. So, passive diffusion means there's channels in the membrane where levodopa simply passes through. However, this means that levodopa can enter or leave the brain, and is only driven by a concentration gradient. A large dose of levodopa is needed to transfer some of it into the brain. And this is bad since our body naturally produces dopamine from it. And while dopamine is known to make us happy, too much of it can cause problems throughout our body. In the heart, it can cause heart palpitations, and it can cause sodium buildup in the kidneys. So to stop this transfer from levodopa to dopamine in the blood, another compound called carbidopa is used. Now, carbidopa, like dopamine, cannot pass through the blood-brain barrier, so it only stops dopamine from being created in the blood and not the brain. So the specific treatment PD would consist of levodopa and carbidopa. Levodopa to be converted into dopamine, and carbidopa to stop any conversion happening in the bloodstream. Thank you. This has been a brief and simple overview of the Parkinson's disease treatment.